everyone. Welcome to Fayette Regional Health Talk. I'm Renee Nesbitt.
And I'm Doug Fischesser. Thank you for joining us. As always, Health Talk is made possible by TV3 and Fayette Regional Health System, so viewers in the Whitewater Valley can be better informed of the health and wellness topics and opportunities in your area.
That's right, Doug. And Fayette Regional Health Talk is also your source for up-to-date health news and events that are important to Connersville, Fayette County, and the entire Whitewater Valley. Leading this edition of Health Talk is a reminder that Fayette Regional is a leader in physical therapy and injury rehabilitation, and our team of certified professionals are committed to getting you back to peak performance for life and sports. On the go, on the job, or on the court, the smallest of injuries can stop you in your tracks. That's why Fayette Regional is here for you with certified athletic trainers and physical therapists working with your doctor to develop your custom treatment plan. Quick treatment from Fayette Regional can lead to a quick recovery to get you back to the active life you enjoy. New patients are being accepted. Visit FayetteRegional.org to learn more.
Fayette Regional Laboratory Services now offers several screenings at discount cash pricing. You don't have to make an appointment, and you don't need an order from a doctor. Direct access lab testing is now available with over 20 different screenings to choose from. Results are quick and sent directly to you so you can share them with your doctor.
Fayette Regional's team includes many specialists in fields such as oncology, cardiology, pulmonology, pain management, therapy services, diagnostic imaging, and more, with dedicated doctors, nurse practitioners, and staff committed to bringing excellent health care to Fayette County and the surrounding area. Fayette Regional is excited to offer Genius 3D mammograph exams. Utilizing advanced breast tomosynthesis technology, Genius exams are clinically proven to significantly increase the detection of breast cancers while simultaneously decreasing the number of women asked to return for additional testing.
Fayette Regional and St. Vincent offer the power of 2 hospitals for your heart's health. The heart is the most important organ in your body. The heartbeat can be detected as early as 12 weeks and continues to beat 100,000 times every day of your life. If you have a heart problem, come to the best heart program in Indiana. St. Vincent's is rated as Indiana's #1 cardiology group, and they are here for you with 7 of Indiana's best physicians and nurse practitioner on staff. It's the power of 2 hospitals for your heart's health, providing unmatched quality and expertise in cardiology.
Fayette Regional's Pulmonology Center offers the area's premier sleep medicine center, offering diagnostic sleep testing in a comfortable home-like setting. Studies show that people who get 7 hours of restful sleep each night lead longer, healthier lives. However, millions suffer daily with sleep disorders that lead to health problems, including high blood pressure, stroke, and heart attacks. If you snore or gasp for air while asleep or are often tired during the day, don't ignore the warning signs. Contact the Fayette Regional Pulmonology Center. For this and more, please visit FayetteRegional.org. When we return, our guest will be in studio to help give us a few more details about Fayette Regional Sleep Lab services. We'll be right back.
Fayette Regional offers the area's premier sleep medicine program with enhanced diagnostic testing in a comfortable home-like setting. 7 hours of restful sleep each night can help you live a longer, healthier life. However, millions suffer daily with sleep disorders that lead to health problems, including high blood pressure, stroke, and heart attacks. If you snore or gasp for air while asleep or are often tired during the day, don't ignore the warning signs. You may be a candidate for the Fayette Regional Sleep Program. Learn more about sleep studies at FayetteRegional.org, your community hospital.
Welcome back. Joining us now is Karen Smith from Fayette Regional Sleep Lab Services. Thanks for joining us today, Karen.
Thank you for having me.
Could you give us a quick overview of your experience and the sleep lab staff at Fayette Regional?
Sure. Our medical director is Dr. Dennis Zawoski. He is board certified in sleep medicine, pulmonary medicine, and critical care. He has been active in sleep medicine for over 30 years and brings a wealth of knowledge to our area. I'm a licensed practical nurse, a respiratory care practitioner, and registered in sleep, and I have been in the sleep field for over 25 years.
Good. Karen, where is the sleep lab located?
Our sleep lab is currently located on the 3rd floor of the hospital with 2 sleep rooms for testing. We will begin remodeling of on the second floor area that will increase our number of beds to 4. We are planning on opening this new area sometime by the end of this year. Each sleep room will be a full suite with the Alice 6 Philips Respironics state-of-the-art sleep system. The system includes video monitoring of each patient as well as CO2 monitoring. The area will include a bedtime snack for the patients and breakfast food as well in the morning.
That's good. Sounds like it's going to be a much-needed area for
Yes.
for the sleep lab. What testing is performed at the sleep lab?
We perform polysomnography testing, which is called a PSG. It's a standard test where you come in and we place all the monitors on you, and it diagnoses if you have sleep apnea as well as other sleeping disorders. And that's the first test you usually have. And then after that, we can do a split night test where you come in and it's the first 2 hours we monitor you. And if you have moderate to severe sleep apnea, then we can stop that test and go right to the machine that night and set what pressure to alleviate that sleep apnea. So you can have just a PSG one night, or is the possibility of a split night test if you are severe. We want to make sure we treat you that same night if you are very severe and get that good health going a little quicker. We also do multi-sleep latency testing, which is consisting of naps during the day. It's 5 naps, and each nap we lay you down every 2 hours for 20 minutes. And that's to detect to see if you go to sleep and what stage of sleep you fall into. This test is mainly done for narcolepsy. It calculates how many times you have dream sleep, and that's where we get narcolepsy, because when you nap during the day, and your naps are for 15 or 20 minutes, you should not reach the level of dream sleep, because that's very deep, and that's what it tests. It tests for the narcolepsy. We also do maintenance of wakefulness tests, which is called an MWT. They do these a lot on truck drivers, and that is to evaluate how you stay awake during the day. That's to show that you can stay awake and that you don't get drowsy and sleepy. Those tests are done 4 tests during the day. Each test is just 2 hours, and for 40 minutes you have to stay awake in a dark room. And that's how they test to make sure that truck drivers can keep licensed and keep driving, to make sure they're going to stay awake. We also do home sleep testing. It's unattended. You come in and pick up the unit from me, usually at night. Take it home. You have one belt that goes around you, a little airflow monitor that goes in the nose, and a little finger probe that goes on the finger. It's a very easy test. It does just directly test for sleep apnea. We also can do titration studies. Say you come one night and you're diagnosed with sleep apnea, and it takes a full night of testing to get that diagnosis. Then typically you will come back for a second night. We'll hook you up, and then you'll be on the CPAP machine, and we test you all night long to see at what pressure that it abolishes your sleep apnea and keeps your throat open, and you get restful sleep for that. We also can titrate oxygen. So if you come in, we can start with 1 liter. We watch your oxygen level all night long. If you need 2, we can turn it up to 2 and see what it takes to keep your level at a healthy level.
I see. Sounds like it's very thorough. Very thorough.
It's a lot of testing.
Great.
Those are a lot of testings that are offered. I did hear you mention CPAP. So for those that are unfamiliar, what is CPAP and BiPAP?
Okay, CPAP is a continuous positive airway pressure. It usually runs from a range of 4 to 20 on the machine, and we start off as low as we can, and it's just added airflow. And it just splints the airway open, and we start off low, and as you snore or we see a slight closure in the throat, we adjust that pressure very slightly and go up till we find just what it takes to keep your airway open and keep you breathing well and well oxygenated. The bi-level is for patients that cannot tolerate CPAP, or if you're older, you may take that bi-level, and it just takes the CPAP pressure, splits it into 2, so when you breathe in, you get the big pressure that opens it up, and when you breathe out, it backs off. So it facilitates your breathing and kind of assists you. It makes it easier and more comfortable.
Oh, okay. So if I felt like I was to need one of these, how could I go about getting a sleep study ordered?
Okay, your primary physician can order that. A pulmonologist can order that, or your cardiologist. You can self-referral into the lab if you think you have a problem. Very welcome. Dr. Zawoski can see you and order that for you as well.
Okay, thank you.
I'm sure you get this question a lot. Will insurance pay for the testing?
Yes, most every insurance will pay for a sleep study probably about every year, but we do call and we make sure that if you need a pre-certification, before you come to the sleep lab, we call and get that done so that when you come, everything's taken care of.
Oh, I see. Okay, great. How long does the test last?
Once you arrive at the lab, you come around 9 o'clock and you'll come in down at the hospital registration. You'll register in and I will come and get you. And shortly after that, you'll go to bed and we monitor you a minimum of 6 hours. It can last 7 or 8, depending on if we get what we need. We're going to run you longer till we get the full test and what we're looking for. And then usually you're up around 5, 5:30 and you're ready to go by 6.
I see, great. Yeah, I understand you all have been very, very busy in the lab.
Yes.
So.
Yes.
Can patients take their regular medications prior to the testing?
Yes, we encourage them to take all the regular medicines. We only ask that if they take a sleep aid or a sleeping pill, please wait till you come to the sleep lab for that. And that's for your safety. Then that way you're there, we're monitoring you, we know what you've taken. If you need one, if you know you can't sleep away from home, then we encourage you to ask your physician for a sleep aid for that particular night to bring and take at the sleep lab.
That makes sense. So what is actually monitored during a sleep test?
During the sleep test, we monitor all the brain waves. It tells us at what stage of sleep you're in and what type of sleep you're actually getting for your sleep architecture. We monitor your eye movement so we can see when you dream and you look back and forth. Monitor the chin muscles through here so we can pick up bruxism, chewing, gastric reflux. We monitor your heart rate and rhythm with EKG. We put 2 monitor belts around you that monitors your breathing in and out. And that mainly tells us the difference between obstructive sleep apnea and central sleep apnea. There is 2. Obstructive is where this closes and there is, you're trying to breathe and you just can't get it open. Central sleep apnea it comes from the brain back here where due to aging or if you've been hit in the head, it just doesn't send the message out. So at that point, then you'll not have movement here or here. So that's what them belts detect. They show us for sure if it's the throat or what we're treating. We also put monitors on the legs for leg movement and kicking and restless leg syndrome. Legs are very common to be kicking and restless when you have sleep apnea. A lot of people don't associate the 2 together, but every time the body slows down, stops breathing, and this closes off even just a little bit, your leg will kick to wake you up and take that deep breath in. So a lot of leg movement is another symptom that we look at to see if you have sleep apnea.
I see. Like most of us, every night, can patients get up during the study if needed?
Oh, absolutely. We can have you up and in the bathroom. We have call lights so we can monitor you, we can see you, and we can hear you. So once you call, we just walk right across. There's 1 cable. We disconnect. We hang the unit around you, which is very small, and you're in the bathroom. Very easy to go to the bathroom.
Oh, great. That's good to know.
And how long does it take to receive the results from the testing?
Usually just 2 to 3 days. By the time the person leaves that morning, we have already scored the study, and it's ready for Dr. Zawoski to read.
Well, that's pretty fast. If a patient receives a diagnosis of sleep apnea, what is the next step for them?
Usually Doc will have them come back in for the titration study, where they'll come back in on the CPAP for a full night, where we adjust that pressure range to see what it takes to abolish the sleep apnea.
I know we've heard a lot about sleep apnea, but is it life-threatening?
Yes. The stress that it puts on the body and all the organs, you may not notice it because most people with sleep apnea, you're the last one to know you have a problem because you're asleep. But if the airway is closed even a little bit and you lose a little oxygenation each night, you're putting stress on all your organs, your heart, your liver, your kidneys, just everything. So we usually see high blood pressure, heart attacks, stroke, cardiac arrhythmias, diabetes, kidney disease. It takes a toll on the entire body, as well as mentally. It can cause a little more depression, mood changes, because if you don't sleep well, you're just not going to be well.
Yeah, I was going to say that was going to be my next question. Some of the symptoms of sleep apnea. I know like I say, you read about it, and you hear a lot about it, and I know
Yes.
that I know that there's a lot of people that are, that have these types of symptoms and these problems. So.
Okay.
Well, thank you so much for stopping in, Karen, and providing us with such a wealth of information. We enjoyed having you today.
Thank you.
Fayette Regional is a leader in physical therapy and injury rehabilitation for life and sports. On the go, on the job, or on the court, the smallest of injuries can stop you in your tracks. That's why Fayette Regional is here for you with certified athletic trainers and physical therapists working with your doctor to develop your custom treatment plan. Quick treatment with Fayette Regional can lead to a quick recovery to get you back to the active life you enjoy. Learn more about physical therapy at fayetteregional.org, your community hospital.
Welcome back. Joining us now is Carol Yeager from Fayette Regional Health System. Thanks for joining us, Carol.
Thanks for having me, Renee.
Carol is the Infection Prevention Director for Fayette Regional Health System. She is also the health coordinator for the team members at Fayette Regional. We appreciate you joining us today. Let's start out by telling us a little bit about yourself.
Well, Doug, I've worked at Fayette Regional for 20 years. I started out in the lab, and now I work in infection prevention and employee health.
Great.
Well, let's get right to it. We know that this is your busy time of year. Has flu season officially begun?
It has for us. We consider flu season October the 1st to March 31st every year. Usually it peaks in January and February, so we haven't seen a lot of cases so far, but we are in flu season.
Okay, so being in flu season, when should I get vaccinated?
If you haven't been vaccinated already, now would be a great time to do that. Vaccine becomes available as early as August, but if you want to be vaccinated before the holiday season comes, that's a good idea. It takes up to 2 weeks for your flu vaccine to become effective after you have the injection.
Carol, what are the different vaccine options available?
Well, we don't have the nasal vaccine anymore. They found that that wasn't as effective as the injectable vaccine. So we have different types of injectable vaccine now.
I see. And where can I get vaccinated?
There's lots of places. Your provider, your primary care provider at your doctor's office can give you a vaccine. The pharmacies will give you a vaccine. All the major chain pharmacies can do that. A lot of employers will do it on site. So there's various places that you can be vaccinated.
I see. One big question is it very costly?
Usually it's covered 100% by insurance. It's considered a wellness option, so it's considered to be covered at 100%, is covered 100% by Medicare as well. So most people don't have to pay anything for their vaccine.
I see, right.
So we know the what and the where, but can you tell me why we should get vaccinated and maybe who should not get vaccinated?
Well, if you don't want to get the flu, the best way to prevent that is to be vaccinated. The CDC recommends that anyone 6 months of age and older be vaccinated every year for the flu. The contradiction or why you shouldn't get that is if you've had a serious reaction to the flu vaccine in the past.
Okay, so speaking of reactions, are there any reactions that we should watch for when getting the vaccination?
Well, you should expect that your arm might be a little sore, red, or swollen at the injection site, and that's normal because you've had an injection in your arm. But if you have a respiratory problem, it might be anaphylactic shock, and you don't want to have a serious reaction. So if you notice respiratory problems or maybe the whole side of your body being weak or tingling, that would be a serious reaction that you need to report to whoever gave you the shot.
Okay, thank you.
Here's a big question in everyone's mind. What's the difference between the cold and the flu?
Well, they're similar. We see a lot of both in the fall and the winter when people are congregated together in close quarters, but they are both respiratory diseases. Usually the cold is milder. Flu has a higher fever, more achiness and muscle pain, and it's a little more serious because you don't really feel like going to work. A lot of us go to work with a common cold, but if you have the flu, it usually puts you down for a few days.
Yeah, usually a lot of aches and pains. What are the common ways the flu is spread, and what are your recommendations on keeping it from spreading?
People spread flu and the cold because they touch contaminated surfaces, and then they'll touch their eyes and nose and mouth. And then if people cough without covering their cough, you breathe in those germs. So the best way would be to disinfect surfaces, and then if you do have to cough or sneeze, use a tissue, or what they say, cough into your elbow so that isn't going into the air for other people to be exposed.
Right, I see.
So you've given us a good insight. Can you give us an overview of what we should maybe expect this flu season?
Every flu season is different, so we won't know until it's past how this flu season is going to go. But usually most of the flu cases are in January and February. That's the peak season. And if you get the flu vaccine, we hope that it works, and that's the best way to prevent it.
Awesome. Well, thank you for that information. Is there anything else that you'd like to add?
No, thank you very much for having me. And if anybody has any questions, I can be reached at the hospital at extension 7789.
Well, thanks for coming in today, Carol. We appreciate it.
Thanks again.
Fayette Regional and St. Vincent offer the power of 2 hospitals for your heart's health. It's the most important organ in your body. The heartbeat can be detected as early as 12 weeks and continues to beat 100,000 times every day of your life. If you have a heart problem, come to the best heart program in Indiana, St. Vincent at Fayette Regional. Because all your life, your heart has been doing the best for you. Learn more about heart care at fayetteregional.org, your community hospital.
Welcome back. Before we wrap up this edition of Health Talk, we would like to give a quick rundown of some other upcoming events. As part of a continuing effort of community outreach, Fayette Regional provides monthly health screenings throughout the area. We will be at Fayette County Senior Center, Fountain Place Apartments, and Pattern Mill Apartments for blood pressure and blood sugar screens. If your group or organization would like us to come to your facility or event, contact us at the email address on the screen. The second Tuesday of each month, Fayette Regional provides a free lunch and screenings at the Fayette County Senior Center. Lunch is served at 11:30. If you wish to attend, please make your reservation by calling the Fayette County Senior Center.
Please join the Fayette Regional staff and the community by supporting our blood drives throughout the year. There is one last blood drive scheduled for Tuesday, December 4th from noon to 4 p.m. Visit our Facebook page for more information and tune in for TV3's listing of local events to find other special events that Fayette Regional is hosting in your area each month. One final reminder, flu season is upon us and Fayette Regional has extended hours for your primary and immediate care needs. Fayette Regional Primary Care Center has a full staff of experienced physicians and nurse practitioners. They can take care of all your immediate care needs 7 days a week, and walk-ins are welcome Monday through Friday, even on weekends for adults, seniors, and kids too.
That's all the time we have today.
We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Renee Nesbitt.
And I'm Doug Fischesser. Stay healthy, Connersville.